Hello, good evening. My name is Rajdeep, and today we are going to present training current employees in nursing. In our group, we are three members: Manshit Kaur, Navdeep, and me. Introduction, topic overview: the significance of continuing education for nursing personnel, particularly with regard to the implementation of new technology to guarantee competent, safe, and efficient patient care. This training is essential. So, next is the human resource issue. Given its direct effects on employee performance, safety, and retention, training is a crucial HR issue in the healthcare industry. So, training impacts job performance and competency. Organization must comply with the training regulation to avoid legal consequences. Proper training improves workplace efficiency and reduces stress among nurses. Training organizational responsibilities. The healthcare organizations oversee making sure that employees receive the training they need to operate new equipment safely and effectively. Important areas. First, introduction when new equipment is introduced. So, initial training on new equipment and procedures. Hospital and healthcare facilities must provide hands on training whenever new medical devices, software, or treatment protocols are introduced. This ensures that nurses can use them safely and efficiently. Competency development and assessment. Training should not end after initial instruction. Organizations should assess nurses' competencies through practical demonstrations, written tests, or simulation to confirm their ability to apply new knowledge in a clinical setting. Next point is refresher training and continuous improvement. So, continuous professional development. So, ongoing education help nurses stay updated on the latest best practices, regulatory changes, and technological advancements in healthcare. For example, when hospital adopt new ventilators for critical care patient, all ICU nurses must be trained on proper usage, troubleshooting, and maintenance to prevent adverse events. The significance of training, development of skills. Training guarantees that employees are capable of operating new machinery, improving operational effectiveness and safety. So, proper training benefits both healthcare organizations and nursing professionals. It enhances nurses' ability to deliver safe, high quality care, increases job satisfaction, and ensure compliance with legal requirements. So, the primary benefits include enhancing competencies and efficiency. Nurses must be proficient in technical skills, example, using infusion pumps and soft skills. For example, effective communication with patients. Training enable them to handle medical situations with confidence. Next is patient safeguarding. Proper training guarantees high standard of care and help avoid mistakes. Inadequate training can lead to medical errors, misdiagnosis, and procedural mistake. Studies shows that proper IV infusion pump training reduce medication errors by 30%, boosting job satisfaction and reduces turnovers. Nurses who feel supported in their professional growth are more likely to remain engaged in their roles. Continuous learning fosters job satisfaction and reduces burnouts. Requirements for law and regulation. Several rules and regulations relevant to staff training must be followed by healthcare institutions. So, healthcare training is not optional, it is legal requirement. Several regulations mandate that hospitals provide continuous education and competency based training for their staff. Example: Occupational Health and Safety Act and Executive Health and Safety Executive Guidelines. So, these requires healthcare institutions to ensure that nurses are trained on workplace safety, infection control, and hazard prevention. The law's role in training healthcare workers. Important rules. Labor regulation regarding certificates, workplace safety, and training. So, licensing and certification. Regulatory bodies such as College of Nurses of Ontario require healthcare workers to meet specific legal criteria before they can practice. So it ensures patient safety. Laws mandate that healthcare training include essential knowledge on infection control, ethics, and patient rights to prevent harm. So criteria for healthcare specific training established by regulatory organizations such as College of Nurses. The CNO enforces laws related to nursing education, registration and competency through the entry to practice competencies and quality assurance program to ensure nurses provide safe, ethical and competent care.
Next is barriers to effective training. Despite recognizing the importance of training, several barriers can hinder its effectiveness in healthcare settings. Time constraints are one of the most common challenges, as busy nursing schedules leave minimal time for structured training. This often leads to incomplete or rushed learning, which may compromise safety and efficiency. Next, financial constraints also pose a challenge as many healthcare organizations operate on limited budgets. High quality training programs, especially for new technologies, can be costly, making it difficult to allocate sufficient resources. Lastly, resistance from staff can be a significant barrier. Nurses may hesitate to adopt new equipment or procedures due to lack of confidence, fear of change, or skepticism about the effectiveness of new methods. Overcoming these barriers requires a strategic and supportive approach, which we will explore in the next slide. Next is strategies to overcome barriers. So, despite the importance of ongoing training, several barriers can hinder its effectiveness. As we discussed in the last slide, these barriers include time constraints due to the demanding nature of nursing, financial limitations, and occasional resistance from staff in adapting to new processes. To address these challenges, we can implement flexible training schedules, allowing staff to complete training during off peak hours or breaks. Online platforms and e learning modules make training accessible and cost effective, enabling staff to learn at their own convenience. Lastly, incorporating interactive and hands on training methods keeps staff engaged and encourages practical skill development. Next is ongoing professional growth. Continuous professional development is essential for ensuring that nurses stay updated with the evolving healthcare technologies and practices. It enhances competency and promotes high quality patient care. Organizations can promote continuous professional development by offering regular workshops and seminars focused on the latest innovations in healthcare. Additionally, self directed learning resources such as online modules and peer reviewed articles empower nurses to pursue ongoing knowledge and skill enhancement independently. Next is support from the organization for development. Organizational support plays a critical role in fostering a culture of continuous development. Mentorship programs are highly effective as they allow experienced nurses to guide and support less experienced colleagues, ensuring a smoother transition into the new roles or technologies. Additionally, providing access to educational resources, whether through an internal knowledge database or partnerships with external learning platforms, empowers staff to enhance their knowledge. Lastly, offering financial assistance for advanced certifications or continuing education demonstrates a commitment to staff development and encourages lifelong learning. Next is role of HR in training. The human resources or the HR department plays a central role in ensuring that nursing staff receives effective and compliant training. HR is responsible for designing and implementing training programs that align with the organizational goals and regulatory requirements. HR also monitors training completion and evaluates its impact on nursing practice and patient outcomes. Well structured training programs contribute significantly to employee satisfaction and retention as they enhance competence and confidence, leading to lower turnover rates.
Good evening, Professor. My name is Navdeep. I'm going to present the next slide, which is evaluating the effectiveness of training, which include that to ensure that training programs are effective, they must be evaluated based on measurable outcomes. So first point is evaluation after training. Post-training assessments helps to determine if the nurses have gained the necessary knowledge and skills. These knowledge and skills include the written exams, practical demonstrations, or competency evaluations. Next point is consistent feedback from nursing personnel. Regular feedback from nursing staff provides the insight into the strengths and weaknesses of the training. These feedback can be gathered from the service or one-on-one discussion. Next point is monitoring the effects in patient care results. Tracking the impact on patient care outcomes ensure that training translates that into the improved patient safety and care quality. Metrics such as reduced errors, better patient recovery rate, and the increased adherence to best patient practices can indicate training success.